One of my Facebook followers asked me recently if he could ride a motorbike again after hip replacement surgery. It's a great question to ask an orthopaedic surgeon. When I was a trainee surgeon, we used to see lots of people who'd had motorbike crashes. The toxic mix of high speed, testosterone, country roads and very often alcohol provided us with plenty of work for the trauma lists. It was common to see several young men on the wards who'd been there for weeks after crashing their bikes. We had to adjust traction, change their plaster casts and wait till their broken bones mended. Some of them, of course, weren't so lucky. I'm no biker, but I used to ride my father's enduro motorbike after I left school. And when I was a medical student, I had a Honda 50 moped. This wasn't the fastest thing in the world, but it was much easier than riding a bike up Headington Hill in Oxford to get to the John Radcliffe Hospital. I never had a crash, but it made me realise how vulnerable you are on a motorbike. But life is for living, and if riding a motorbike is your thing, then let's have a look at what the hazards might be if you've had a hip replacement. Over the years, I've had plenty of patients, men and women, who enjoy riding a motorbike. The general risks of riding are the same as always: cracked heads, broken bones, spinal cord injuries, bleeding from abdominal injuries, and everything else. But because I'm a hip surgeon, the risk that worries me the most is having a dislocation. This is when the ball part of the joint comes out of the socket. This can happen when you get on or off the bike or try to start it. Look at Richard Gere in Officer and a Gentleman starting his Triumph Bonneville. He brings his hip into deep flexion and then puts all of his body weight through the starting lever. This manoeuvre will put a lot of load through the hip joint. Most modern bikes these days have electric starters, which makes it much easier on their hips. Just to make things more complicated, in a high-speed crash, the bone in the socket can fracture. Sometimes the thigh bone, the femur, can break around the implant. These injuries will need to have complex surgery to reconstruct the hip joint. So, should you ride a motorbike after having a hip replacement? Well, my advice is, maybe. If you're an experienced rider and understand the risks, I don't see why not. I would wait until you're fully recovered from surgery and are not thinking about your hip anymore. This will take at least 3 months. You might feel more comfortable with a bike that allows you to sit up rather than one that has a more aggressive riding position. As with everything in life, it's all about weighing up the risks and the benefits. If you're a biker, then you're all too aware of this. I hope that you find this helpful. If you'd like to know more, then please get in touch. The details are in the description below. Happy riding.